Right, fantastic. So we've got 167 folks on the call right now, which is very exciting. So welcome to our webinar discussing our Global Masters in Public Health at Imperial College London. We're really excited to have you here and to tell you a little bit about our program, what's going on, how you can join, and what you need to do to make an application. So before we get going, just a few housekeeping rules. So we've disabled the chat function. So you'll see the question and answer function here at the bottom of your screen. If you have any questions, please send them in. We'll have our team, Anna and Patson, will be answering those. And then at the very end of the webinar, we'll take 15 minutes and we'll answer any questions that you've got live. So I will go ahead and tell you what we're going to do. And then as everyone joins and starts to talk about their part, they can introduce themselves and we can kind of swiftly move through the next hour. So our agenda is as follows. So Professor Pauline Aylen and Professor Helen Ward are going to talk to you a little about the Global Master in Public Health generally as the course directors. Then I'm going to speak about the course experience, a little bit more about assessments, about what you'll expect on the courses themselves. Ms. Jenny Husbands, our senior tutor, is going to talk about the tutoring system. And then we're going to give you an overview of the GMPH admissions process from Anna, and then an overview of the health protection specialization from Dr. Wendy Kwok, who is leading that specialization. And then finally, we will have question and answers for you for about 15 minutes. Great. So with that, I will hand it over to Paul and Helen to tell you a little bit more about our course.
Okay, thanks, thanks, Kat. So I ought to introduce myself. My name's Professor Paul Aylen, and I am the co-director of the Global Masters of Public Health course, together with Helen. Do you want to introduce yourself as well?
Yeah. Hello, everybody. My name is Helen Ward. I'm a Professor of Public Health and lead this course with Paul, and we have different areas of expertise, but joined together in our general public health experience on this course. So looking forward to talking to you this afternoon, whatever time of day it is where you are.
Thanks, Helen. So I thought it might be useful. I mean, the idea for this course probably started 3 or 4 years ago. We have a very solid on-campus Masters in Public Health that we offer as part of a suite of postgraduate degrees that the School of Public Health offers. But it soon became clear to us that there was a greater demand for Master of Public Health than we could satisfy with our on-campus course alone. So we, both Helen and I, talked about producing a online course. We were very keen that this would not simply be a sort of videoing of our on-campus lectures and putting up online, that this would be designed right from the ground up in a modern package or platform, and we decided to go with Coursera for that platform. And we've spent the first 2 years developing content, and you can actually see some of that content in the form of some of the open content that we have on Coursera on MOOCs. And we had our first intake last year, and we've got our second intake just started this year, and it's proving to be a very popular course, which I think is open to a different kind of student perhaps than the on-campus course. And these may be students who are already in full-time employment and want to develop their careers further, or who for other circumstances can only do a part-time degree. So this degree is a 2-year degree. It's part-time, but it's still a lot of work. It's designed to take up at least 20 hours a week. and we have a number of options of how you can go about it. So our initial offer was for a 2-year part-time master's with no options really to sign up for an intermediate degree between then, although if you didn't manage to complete your master's, you are able to exit with a PG cert or a PG postgraduate diploma. But this year we're offering an even more flexible option of doing a master's in sections at different stages. So doing a postgraduate certificate, then a postgraduate diploma, and then moving on to a master's. And you can do this degree over a minimum of a 3-year period. So can we go to the next slide? So this is the 2-year course overview. And in the first year and the first term, you get down to some really essential core modules for a Master of Public Health. You get epidemiology and foundations of public health practice, as well as another module giving you an overview of some of the important problems and conditions that are facing us in terms of diseases. And then the second term, you move into statistics, another essential module. And then you also get health systems development. And then we've started to build in some choices, some options. So you're able to choose from a range of elective modules, global health innovations, infectious disease modeling, health protection, and quality improvement in healthcare. The third term, you get more, another core module together with elective options. And then you also begin your research project. And perhaps it might be useful if I just elaborate a little bit about how we've designed the course to support a research element for this degree. And we've very much thought about this as an online offering. And considering students' backgrounds, we wanted to be able to support students in choosing a research question or designing a research question out of their own interests, rather than giving them a research project. But in order to be able to enable this, you need certain skills. And so we've built the concept of a research portfolio, which takes you through the different stages of coming up with a research question, doing your background literature, designing a protocol, so making a choice of a methodological approach to your research, and then giving you some core research skills in term 5 around how would you go about applying for a grant, how would you get ethics approval, and some elements around patient and public involvement in your research. And then the very final term is completely devoted to finishing your research project, writing it up and submitting it in the format of a publishable article in a research journal format. So that's a research project, and you start that in term 3. In year 2, you go on to do a bit more of that research portfolio. You also get core and elective options. Term 5, you get to do health economics together with other elective options, as well as this research portfolio. And as I said, the final term is devoted to finishing off your research portfolio. So the research portfolio accounts for about a third, well, exactly a third of the overall Masters in Public Health, which means that when we offer the 3-year option, and specifically if you choose to do a PG cert or a PG diploma, then the bulk of that is available within our core modules and electives. So if you just chose to do a postgraduate certificate, you'd be doing a couple of modules each term, including the essential core modules of epidemiology for public health, foundations of public health practice, statistics, and population health improvement, as well as some of these options that are available to the masters. If you wanted to do a postgraduate diploma and stay on for another year, you then get the option of those further core and elective modules. If you want to go on to do your full Master of Public Health, you can opt to do the research portfolio in that the last term of year 2, and the bulk of year 3 is indeed that research portfolio. So that's the options that we're offering you: a 2-year Global Master of Public Health and a 3-year option, which is staged into a certificate, a diploma, and then the 3rd year you do the work to qualify for a Master of Public Health. What's our next slide?
Ooh, sorry guys, that advanced much further than it should have. Let's go back here. So
that is the last slide. Helen, did you want to add anything to that? I've rather rabbited on in my enthusiasm, as I'm one to do.
I think it's probably worth pointing out that, or emphasising that, if you do the 2-year Masters in Public Health, it is a half-time. So if you did the full-time one on campus, that is full-time. That is 5 days a week working, and you can't really combine that with working, at least not during the day. So if we say that is about 40 hours a week, then this is at least 20 hours a week of study. So it's worth being aware of that. This is not just a few hours that you can fit into the weekend. So that's the 2-year one.
Yeah, it's a sizable commitment.
It's a sizable commitment, but it's a full master's degree from Imperial College. If you choose to spread it out over a longer period and do the certificate diploma approach, then it's still, you're doing 2/3 of that work. So we would expect it to be 12 to 14 hours a week of study for those each year while you get your certificate. But then obviously you've got the flexibility of choosing whether to continue, etc. So it is more flexible. It is possible to interrupt and things like that with this more flexible approach. So it's designed in order that you can use these building blocks and put them together, so that eventually you can get a degree, or you can exit at an earlier point with either a certificate or a diploma. So I think that's just worth pointing out, that it's not something to be assumed that you can do in very, very part-time, whichever approach you take. So just being honest about that. It's feedback we've had from the students, that it's enjoyable and satisfying, but it's a proper course of study.
Yes, challenging, I think, is some of the words, and you wouldn't expect anything less from a master's course at Imperial. It should be challenging.
So I think that, the next section is to talk about how we support. So while we're challenging you, we're also supporting you and trying to guide you through this, both with our tutoring support and also eventually with careers and with networking. And it's an amazing opportunity to get to know a range of people across Imperial School of Public Health who are involved in the teaching. So I think I'll hand over now and answer questions later.
Absolutely. Thank you guys both so much for doing such a comprehensive look at our program. And I think just the only other thing to say is this really is both a combination of theory and practice. As you go along, as Paul was mentioning, you'll learn those really core essential public health skills, but you also get to apply them in assessments and various other ways, to outbreak reporting, to designing interventions, thinking about various ways that you can apply public health to policy, and other really interesting and exciting assessments, as well as just activities as you move along. So we really feel like it sets you up, whether or not you want to do that certification, the diploma, or the master's, really sets you up to be a public health professional moving forward. So with that, I'll hand over to Jenny if you want to introduce yourself and introduce the tutoring system.
Thank you very much, Kat. Hi, my name's Jenny Husbands, and some of you may have been in contact with me already. I've been emailing you and telling you who your personal tutor is. But basically, I'm the senior tutor for the School of Public Health. I'm also a personal tutor for a group of students on the Global Masters in Public Health. And the purpose of this presentation is basically to give you a clear understanding of how the tutoring system works at Imperial College, and also so we can support and enhance your learning. So a personal tutor then is usually a member of academic staff who's allocated to you to offer you help and support with academic and personal issues. And some of you will know that your personal tutor may be somebody who's also studying for a PhD. A personal tutor will also follow your progress throughout your time on the course, and it's basically to help you keep on track so that you succeed in your studies. And all of you now should have been in contact in some way, shape or form with your personal tutor. Patsy? Thank you.
Sorry guys,
That's okay.
Some technical issues. Let's get back to where we were.
Is that the next one? Okay, so your personal tutor then, basically what we do is discuss any aspect of university life which impacts on your learning. So it may be, for example, personal problems, financial problems, health problems. Quite a few have been in contact recently because you're having babies, or anything like that we're kind of involved in. And we collectively call those issues pastoral care. We also advise you on your academic progress. So, for example, if you're struggling a little bit with your studies, we help you to identify what your strengths and weaknesses are, and then we can signpost you to the appropriate services within the university which are there to support your studies and to enable you to succeed. And we can also write a academic reference for you. So, for example, when you finished your studies and you want to apply for a job or for further study, we can write a reference for you, but that obviously would depend on us knowing you. So you'd have to kind of engage in the tutoring system to enable us to do that. So how often you see your personal tutors? I know that a lot of you at the moment have been doing your presentations with your personal tutors and kind of negotiating that. But ideally, we'd like to see you as a group at least once a term, and then individually, that's between you and your personal tutors. And what we'd like you to do as much as possible is to initiate that contact. Don't always wait for your tutor to contact you. Just drop them an email saying you'd like to meet, and we'd be happy to do so. So as I said, you will all now have been allocated your personal tutor. So if you haven't met them, do make a point of contacting them. I just want
Jenny, can I just clarify, these are not current students, these are people about to apply, so they've not yet. So just in case anyone's confused.
Right, sorry about that. Okay, so when you start the course, I will correct myself, you will be allocated a personal tutor, and the personal tutor, as I said, will meet you as a group of students. There's usually about 5, maximum 6 of you in the group, but also individually they will meet you as well. And we look forward to meeting you, working with you, and best of luck with all your future endeavours. Thanks, Kat.
Thanks so much, Jenny. And as Jenny was saying, and as Helen was saying as well, this really is an opportunity for you all to get more entrenched in the community, think about what research is going on, learn a little bit more about that. You obviously get that through the research portfolio as well, but really just provides the support that you need to be successful in your studies. And we really find that this tutoring system can be helpful, especially if you're coming back into academia for after being away for a while or whatnot. It can be quite helpful, and also studying at a distance, of course. So with that, we'll move on to a really brief overview of how to apply and some of the key factors that you need to think about. I'm going to go ahead and do this as Anna's answering questions for us today very kindly. So generally, how do we apply? So you can find our application portal or find information on our course through a couple of different ways. So the first is that you might have actually seen some of our live open content on Coursera, worked through epidemiology, let's say, and then say, you know what, I want to go to Imperial, let me go and find out more. And you can click on our then Imperial webpage on Coursera. That tells you more information about our program and also allows you to come to our own website to apply. Similarly, you can go to the Imperial website, apply right there. It tells you all the same really wonderful information. So we just want to make it open and available, look into things, see what you like. And if you're ready to make that application, you can go ahead and apply on our online system. You'll need to draw together quite a number of different forms as well as fill out a number of different things. So we definitely say go and look at that application portal early, understand what you need to provide, and try and get that together as quick as you can. We do review applications on a rolling basis and try and hit our numbers for our incoming cohorts. So we definitely say apply early. If you then are given an offer, you're given a little bit of time to accept, think about if you want to come with us or not, and we obviously hope that you do. And then after that stage, you come to us and we put you through the onboarding course. There's a lot of information about Imperial, about the GMPH, and you learn quite a bit more before you then go ahead and start on your regular courses. So let's think about the application itself. What are our reviewers looking for? So as you can see here, there's some basic bullet points about what we're looking for, but essentially we want to know, why do you want to study with us and why do you want to study public health? So we look at your relevant backgrounds. Maybe you are a medic and have been doing some work and realize actually understanding more about the social determinants of health would really help you. And you want to then go ahead and pursue public health to help you with that. You might be switching careers, and that's absolutely fine. There's no problem with that at all. We do take folks from different backgrounds. One of the things that we really do like to see, however, is that you've got some kind of quantitative skills. So if you can provide us any information about courses that you might have taken in the past, even certificates that you might have done online through Coursera, or just explain to us in your personal statement, that maybe this is one of the reasons why you want to join the course. You want to learn a little bit more about statistics, get those skills up so that you can be a good public health professional. So again, the big things here are why Imperial, why this program, and why public health. So as I mentioned, there's a couple of different things that you need to put in through the portal. Includes references. If you need English language tests, those go in there as well. Includes a CV and a personal statement. And the biggest thing that we look at is your personal statement. And so when we review this really gives us a sense of who you are and why you want to join our program. So spend some really good time thinking about this in advance of putting it in, and make sure that you really tell us who you are. This is the opportunity you get to convince us that you're right for our program. And like I said, we have a variety of different backgrounds. We've got someone that's joined us last year as a theologian and wants a change. We've got some folks switching from finance and some folks that have been public health for a while and really just want to upskill themselves. No matter what it is, that's absolutely fine. Just tell us, make sure that it's really clear. The last thing we ask that you please put in your personal statement is a small sort of research question and some thoughts about what you might want to do moving forward. You're not bound to do this. There's no obligation. You can switch once you get into the program, but it just gives us a sense of what you're interested in and makes us kind of certain that you want to undertake this research component, which is, as Paul mentioned, a third of the program. So just a few things to note. We do require English language tests as a requirement to join the program. Because of the sort of disruption with COVID, we do still take the TOEFL and the IELTS as well as Duolingo. And at present, we also offer a pre-sessional English program if you're unable to meet the English language requirements in any other way. So just to put you at ease, we know it's really difficult at the moment. Tests aren't up and running. Hopefully that'll change very soon. And things will get a bit back to normal, but we recognize that that can be a stressor for students at the moment. So we wanted to make that very clear. And then again, there are some differences in the way that applications are being processed and pushed forward this year due to COVID. So please go and see the COVID website in particular to find out a bit more information. And just look at our general FAQs. If you've got any questions, then obviously we can continue to answer your questions as they come in as well. So with that, I'm going to hand it over to Wendy to talk us a little bit about the health protection module.
Thanks, Kat. Good afternoon, everyone. My name is Dr. Wendy Kwok. I'm the teaching fellow for the health protection specialization. So I'm going to outline the specialization and walk you through the aims, the learning outcomes, and the assessments to give you an idea of what specializations look like within the GMPH. Health protection is an elective which students can take in the spring term. So the academic team comprises Kat, our senior teaching fellow, who has a wealth of experience in humanitarian work in Sierra Leone, and myself. I'm a veterinarian and a One Health specialist. We're very ably supported by our graduate teaching assistants, Daniela and Tisha, and also by our colleagues in the digital learning team, Mariana, Alex, Teo, and Kirsten, who are instrumental in developing and implementing the teaching material for this specialization. So this specialization aims to develop students' knowledge across the breadth of health protection topics, including the protection of individuals, groups, and populations through the collaborative effort of experts in identifying, preventing, and mitigating the impacts of infectious diseases and environmental, chemical, and radiological threats. This will facilitate the critical appraisal of responses to health protection threats. Students will learn principles and practices for outbreak investigation and management, applicable in both high and low income settings. Through learning about several important emerging and neglected tropical diseases, students will better understand how outbreak investigation and management need to be tailored to the characteristics of a specific threat. Throughout the specialization, students will have exposure to a simulated real-time outbreak that will encourage students to apply the skills learned during the course. In addition, by the end of the specialization, students will be better equipped to critically appraise operational and strategic responses to a range of health protection threats. So this leads us to the learning outcomes for the specialization. These reflect the aims of the specialization, and it covers the theory underlying health protection, ranging from the biology, epidemiology, and clinical features of diseases of public health importance, and health protection principles to the practical application of this theory in responding to and managing outbreaks. These intended learning outcomes are designed to equip students with the skills, analytical frameworks, and knowledge that health protection practitioners use in their daily practice. Each week, there are 3 to 4 specific learning outcomes which relate to the topic of the week, and these all feed into these overarching specialization learning outcomes. This helps to illustrate the concepts with examples from real-life outbreaks. So moving on to the structure of the specialization, there are 3 sections within health protection, each of which lasts 4 weeks. Following these 3 sections, students will have a further 4 weeks to work on their assessments. The introduction to health protection covers the basics of health protection, which includes what is health protection, what are the guiding and fundamental principles of health protection, basic definitions, and the management of acute health protection incidents. We'll also cover epidemiological concepts and diagnostic test interpretation for investigating and managing outbreaks. This leads us to the next section, investigating outbreaks. In this section, using emerging and neglected tropical diseases as case studies, students will learn key steps in outbreak investigation, including outbreak declaration, developing case definitions, case finding, interpreting outbreak data, contact tracing, and developing and implementing outbreak control measures. Some of the diseases covered include dengue fever, leishmania, cholera, Zika, and Marburg. In the managing outbreaks section, students will learn about developing and implementing risk communication strategies for health protection incidents. Students will also learn how to apply a One Health lens to evaluate outbreak context and tailor outbreak control interventions accordingly. Throughout the specialization, there will be a simulated outbreak of a mystery disease so that students can experience what it's like to investigate and manage an outbreak. The idea is that this can prepare students to respond to an outbreak in their professional lives. The outbreak investigation report then is worth 85% of the grade for the specialization. Students will analyze data that is released weekly during live sessions. Using skills learned throughout the specialization, students will identify the causative agent of the mystery disease X, develop recommendations for managing this outbreak, and summarize their findings in an outbreak investigation report. To accompany this, students will develop an outbreak communication strategy to explain the outbreak and control measures to the public and relevant stakeholders. This is an opportunity for students to show how their risk communication is underpinned by communication theory and outbreak management skills, which they've picked up throughout the specialization. I'm now going to hand back over to Kat, but I'm happy to take questions relating to health protection in the Q&A session that will come up shortly.
Great, thank you so much, Wendy. So that kind of brings us to the end of the Q&A section. We've got some other useful links here so that you can investigate more about our program, some frequently asked questions, which are incredibly helpful as you do go through the application process. We've got some college level guidance, as we mentioned, about COVID, and you're more than welcome to email us at GMPH queries if you do have any specific questions that you can't find the answers to on the various different web pages. So with that, Anna and Patston, are there any questions that are coming up that we can field and answer?
Yes.
Yeah, can I just?
Yes.
That was a really useful presentation from Wendy about the content of the course. But I wonder if you could give the students a sense of what it feels like to do the course. We've got a range of asynchronous and synchronous kind of activities, from videos to exercises to some reading, but we also have some live webinars as well for our students. I wonder if you could just talk a little bit about that.
Absolutely. So each week, the structure of the content is that we have a couple of videos which are made by the health protection team that goes over the theme of the week. For example, one of the weeks will be cholera, so we'll go into the biology and epidemiology and clinical features of cholera. And then this will be followed by activities to reinforce the learning in the video. So this might take the form of readings. We'll provide published peer-reviewed academic papers. And there will also be activities. So this might be H5P or Padlet. So these are much more interactive than reading, and it involves interacting with your fellow students and reflecting on each other's work and kind of building that community and having that dialogue with your fellow learners, which we think is really valuable. And so that is all asynchronous, so that can be done in your own time. But most weeks we will have live sessions, which are synchronous. So everybody comes into a Zoom session together where we'll run a tutorial. And these activities for health protection primarily will be each week we might interview a role play type of situation where I pretend to be a patient in the outbreak and the students will interview me. Sometimes we'll have breakout rooms, so students will be put into small groups within our Zoom classroom and to discuss certain tasks, for example, to do journal club on academic papers. And so occasionally we'll also have guest speakers come in to give you an idea of what it's really like to be a health protection practitioner. So there's a big variety of activities. We try and keep it very interesting for you.
Great, thank you. I think that does give a sense of the sort of variety of different kinds of materials that we provide for you. And as Wendy said, much of the content you can do asynchronously in your own time, and you can pace yourself. There are timed assessments throughout the course which you need to do by a certain time, and sometimes there's a window around those. All the webinars that we have are recorded, so you can have, even if you can't make the live session, you can have access to those webinars after they've happened.
Absolutely.
Thanks.
Thanks so much, Paul. Great overview. And I think what we found thus far is that our students really like this mix of synchronous and asynchronous. Obviously, you've got busy lives. We know that you're working, you're raising families, you're doing all sorts of things. And so the goal, as we've been saying, is really to give you an opportunity to engage as and when you can. Obviously, as Paul said, those assessments have to be done in a specific time frame, but everything else can kind of be done at your own time, as long as you do keep up and are really aware of how much time you need to devote to be successful in the program. And just to say as well that the cohort, our first cohort, it has been absolutely fabulous and built a really wonderful community, which they have been engaging with around jobs, careers, engaging with us around that as well, but have really enjoyed being able to build those connections across the globe. I think 78 countries across the globe, with folks joining from those to really understand what's going on in public health in far-reaching and ranging areas, which is fantastic.
Can I just add to that? I think that's been clarifying exactly what it appears to feel like. Obviously, we're the the tutors on this rather than the students, but it is more interactive than you would expect. Students do get to know each other. There's a lot of chat goes on via Slack and other channels where students meet each other. And one of the things that we have learned from the first cohort is that we're trying to identify more ways in which the online students doing the GMPH can interact with the students who are on campus doing the Masters of Public Health. So we do try and have events that go across the different cohorts and make sure that although students are remote from the physically being at Imperial, that they are able to take advantage of seminars and sessions and feel as much part of the School of Public Health as is possible. And I think that there's been a few questions I've seen in the Q&A. So Cynthia asks about busy weeks and light ones, and we know quite a lot of people who do this. Often clinicians, for example, will have times when they're on call and they're not on call, and it is perfectly possible if you structure your time to do a lot in one week and less the next week, as long as you pay attention to the deadlines. I guess that's the case. And in terms of the live sessions, they are sometimes it's between 3 and 6 hours a week of actual live face-to-face sessions if you can make the times. So that's quite a lot compared to some on-campus courses, I have to say. That's so for each of your specialisation, you usually get 1 or 2 hours of either a seminar tutorial that has been described or office hours where you can interact with one or more of the teaching fellows or the academic staff. So any other questions you'd like us to answer to?
So I can see that there's a number of questions about career opportunities moving forward from the Global Masters in Public Health, and I think, or the Global Certificates or Diploma. And I think that's a really great question. So maybe I can turn it over to you, Helen, first to give kind of your thoughts, and then maybe we can go around. I know that everyone comes at this at a very different, from a very different approach in a very different way. You can really do anything in public health. It's really broad ranging. So I think hearing from our various panel members about what they've done might be better than just saying you can do policy or practice or clinical or anything else that you so choose.
Yeah, well, I'll start by saying my background is clinical medicine, and early on as a clinician I specialised in HIV and sexual health. So that took me into something that's very closely aligned to public health, of course, which is infectious disease, and particularly with HIV being such an emerging threat, which required a lot of response. Then I got interested in the research and the prevention aspects, and so I trained both in clinical the clinical work of HIV and sexual health, but also trained in public health, and then shifted into more of an academic career. But during that process, I ran clinics for sex workers and other people who were vulnerable to HIV, and did lots of prevention programs, did quite a lot of advocacy work, and then did a lot of research around that. I've also had the opportunity to travel and support programs and work with programs in sub-Saharan Africa, looking at obstacles to uptake of preventive programs. And like probably everybody else, and recently I've been involved in COVID response work and developing mass sort of research on testing and looking at mass surveillance of coronavirus in the UK. So yeah, it's been a very varied career with lots of opportunities, but Paul has had a slightly different trajectory, another clinician, but I think we're a minority in terms of academics in the School of Public Health.
Yeah, so after I finished my training, I stumbled into some work at the Office for National Statistics in the UK, which is a sort of central vital statistics office, and there I was focusing on mortality data and how to improve quality of mortality data. I was Dr. Death in the Office for National Statistics. And then I moved into academia and started off in environmental epidemiology, so looking at the impact of pollution sources on the local population's health and measuring that through both modeling the pollution, but also using routinely collected health statistics to look at things like hospital admissions and cancer registrations and things like that. And then I moved into health service research, and I did some work for a couple of big public health inquiries into big health scandals in the UK. Worked on those, and I've been working really on health service research since then, looking at mortality rates by hospital, or looking at times of admissions and how that affects outcomes, a whole range of issues. And of course, we're all a little bit tied up, some more than others, in the latest pandemic. And you've probably seen the profile of Imperial College globally in terms of the work that it's doing on COVID. Helen's been involved in a very big project doing mass testing on the population. And I've been doing some work on the impact of COVID on other patients and health service supply and demand.
Great.
That's me.
Maybe I can turn it over to Wendy, who's got a very different background and very exciting one as well.
Well, my background is in veterinary medicine, actually. That was where I started off. I trained in Glasgow, and then I spent about 3 years in practice as a general practitioner with small animals, and then decided that I wasn't satisfied with a Band-Aid solution dealing with effectively not addressing the social determinants of health for animals, really, which are actually intimately related to human health. Like, I've had many cases where there are heart disease or diabetes and chronic non-communicable diseases that you see in veterinary patients, and their owner actually has the same issue. So animals are sort of a sentinel for human health in some ways. And so I started to understand that there was a connection between environmental and animal and human health. And that was what led me to do a master's at the London School of Hygiene and Tropical Medicine in One Health and Infectious Diseases, where I got a much more global view of social determinants of health and global health challenges and infectious diseases as well. And I also have a background in virological research. Most of my thesis projects were either in coronavirus in cats, not in humans, or hepatitis E virus in pigs. So I was looking at zoonotic diseases in the food chain. And I've also subsequently, after my master's, I then went back to Hong Kong, which is where my family's from, to do research in veterinary epidemiology. And I think one of the major projects that I worked on there was to do a pilot study to investigate the prevalence of antimicrobial resistance in retail foods. And that was really informative in terms of thinking about how you can translate bench-side science into policy. And that really kind of gave me a lot of insight into working in the government and how science and government can marry together to do more effective things for improving health. So after that, then I joined Imperial, and here I am.
Fantastic, Wendy. Thanks so much for that. A very different way into global health and public health. Ginny, can I ask you to give a little bit about how you got into the global and public health sphere as well?
Thanks, Kat. I worked prior to becoming a lecturer as a what used to be called a health promotion specialist, and my area was basically supporting primary care staff to introduce brief interventions into their practice, so to look at how research could be used in the 7-minute consultation time that GPs had with their patients. And we focused particularly around smoking interventions, healthy eating and weight management. And after that, I became a lecturer in further education, and this is my third lecturing job in higher education, so it's kind of a very short route. I haven't got an extensive research background, but I have got experience of working in public health.
Great, thanks so much, Jenny. And I think you can see from everyone here that we've all come in to global and public health from a different route. And I myself did a master's in international public health and worked in the field primarily in sub-Saharan Africa, working on research projects, project design and project implementation. And my area of interest is translating data into action, so evidence to action, as some teams call it these days. So I think, as you can see, you've got the clinicians that came across public health, you've got kind of big quality improvements, you've got localized, more sort of patient interventions, and then this connection between animal health, the environment, and human health. And so I think this just really shows that if you join this program, you can really go in any direction you'd like. If you do decide to join, we do have lots of alumni, other folks at Imperial as well, that can give you a sense of various other directions you can go in, academic or not, and really have an opportunity to explore what you're most interested in, knowing that this field is just fantastically huge, and obviously very popular at the moment as well. So, are there any other questions that are coming up that we can answer?
There's an interesting question.
Yeah, I'm looking at questions now, and I think there's a few very specific ones. And I noticed that Kabir has asked, is a PharmD student from India wishing to join health informatics? And the answer is yes, there's plenty of scope for pharmacists. We have got pharmacists who are on the programme and indeed teaching on the programme. So I think it's a really growing area. Pharmacy is increasingly important, both in clinical services, but also in public health practice. So I think it's a very opportune. And so we're interested in people from a range of backgrounds. Somebody else, yes, Alex asked if you are mostly interested in epidemiology, but from a global perspective, would you recommend applying to this or straight epidemiology? That is a really good question. I think we cover a lot of epidemiology in this programme, and if you pick a research project that is predominantly epidemiology and particular quantitative one, then you will learn a lot of epidemiology. However, some people are more drawn to the more conceptual and pure epidemiology side, and we don't have an online, but we do have a course in epidemiology on campus. I myself did an MSc in epidemiology because that's what I felt I needed. I felt that the other things I'd learnt more of in my undergraduate medicine, and I wanted to get more of the technical skills. So it's very much up to you, but you will get a lot of epidemiology. We have epidemiology statistics, advanced statistics, and we do infectious disease modelling. So there's quite a lot of epidemiology in this course if you wish to take it. So Paul, can you see the court? You can see if there's any others you wish to.
Yes, I think Nida or Nida asks, hi, I'm a researcher, so how can this course be beneficial for me? And I think that's really talking to the research portfolio, which takes you through, or many of the steps that you need to go through as a researcher. So it'll give you that sort of real life experience and skills that you'll need to go on and do research. So as an example, our first module, our first research portfolio module, takes you through how to do a systematic review and how to adapt that for a background review. So you might use that for either a proposal for writing up your research project, or your research may involve systematic reviews, and so that gives you the skills and the experience in a practical research area. And we take you through both qualitative approaches to research and quantitative approaches to research. You'll get experience in writing a protocol, and you'll also get experiences in writing grant applications, ethics applications. So all these skills are really useful for you if you want to go in and pursue an academic research career, or a non-academic research career even.
There's a couple There's a couple of questions I've noticed about the relationship with the, for example, Jeffrey asks about if you take the introduction to statistics and the public health on Coursera and complete those, does it count? So there's some technical answer to that, which I'll ask Kat to give.
Yes, absolutely.
But I think in general, if you've done the work on these MOOCs that are available, then that is a lot of the more asynchronous content is on there, but there is well, at least a third, again, amount of material that we give, which is for degree students. And that includes all the interactive and the more supervised assessments and so on. But Kat, you can say something about the recognition of that work.
Yes, absolutely. And I think it's a really good question, and one that we are constantly working with Coursera to make clear and understandable to prospective students and students that do enroll on our course. So the idea with this is that it gives you a taster, as we've been talking about, of what we do offer on our course. It is at a master's level. We do not have all of the contents on our degree, of course, on the open content. However, there is, as much as we can, we do item link, which is what Coursera calls this, that your progress can transfer over. There's some various reasons from a technical perspective why not all of those things can be transferred over, but generally what we say to students when they join us is, we do expect you to go back through the material, make sure that you're prepared to do your assessments, and make sure that you're learning along. And especially if you want to join in with those live sessions, you may want to do a refresher, you may want to look at things again. But if you feel really comfortable with the content, you can whiz through it a little bit faster. And if you need a bit more time, then obviously we're here to support you in a much more full way than you would on the degree, on the MOOC content as well, because obviously you're doing that on your own with a group of learners. So that's the sort of long and short. Yes, there are stackable credits. You will see some of that stuff transferred over, but we don't take it for credit bearing kind of credits here at Imperial. You will need.
I think we would say that if you want to get a flavour, at least of the asynchronous stuff, the content that we provide, then it's well worth going onto Coursera and doing one or two of those MOOCs to get a flavour of what an online learning experience is with Imperial.
Absolutely. And I would just say as well, I know we've been talking a lot about the sort of quanti side of things. If you are a bit worried that perhaps that you'll struggle with that, it might be a good opportunity as well to look at the epi or stats and see how you feel. We can, if you do want to join and you are accepted, we can provide some kind of crash courses before you get started over the summer, if that's something that you feel like you need to beef up a little bit. But just to say as well, we've got more of the kind of humanities side of things. If you want to look at some of those courses as well, more going live every day. So it gives you a sense of what you've got on the program. And just to say as well, as you move through the program, we do have both sides, both the quantitative and kind of the humanities side of things. And if you are less quantitatively inclined, when you start to do your electives, you don't by any means have to continue forward, but we want you to have that foundational statistics and epi skill just as much as we want to have you have the foundations of public health practice and health systems development, which I know for that some of those of you that are coming from a biostats background may be new and different and challenging in their own right. Okay, so I saw another question around two questions around accreditation and financial aid, which I just wanted to briefly touch on. We do offer scholarships, but we don't offer financial aid insofar as the way that the US does that through the federal financial aid system. However, there may be other ways that you can secure funding through bursaries or various other things in your own country. So what we would suggest is to, again, apply early to our program so that you then are able to apply for the scholarships that we have. I think typically we review those in the early parts of the next year, so kind of early springish time. So do make sure that you get that in so that you potentially can be eligible for the scholarship, and then also explore anything that you might be able to see in your own home countries as well. And then to the question about accreditation. So this is a bit of a tricky one to answer in the sense that please don't worry, we don't sign up to an accreditation body, and that's a choice of Imperial, and also because it doesn't really fit as well within the UK system. We can go into all of the kind of technical details, but I think the thing to take home from this is that it doesn't affect the degree that you get in any way. The Imperial degree is really well respected all across the world, and no one will kind of see that and say, oh no, you didn't actually complete this program, or it's not up to standard. Definitely Imperial is really well regarded, and the accreditation of the school is not an issue there. I don't know, Paul and Helen, if you want to add anything more to that as well.
One of the reasons that we have not gone for specific accreditations is they're very different in different parts of the world. So they're very much associated with public health practice, as that is done in a particular region or country, and have very, very strict requirements of what you need to cover. And ours is, although we cover practice, it's an academic degree. You learn about the principles, the theory, as well as the practice. It's not a training for a very specific role. It is a general, broad education, which we think is what our strengths are. Our strengths are in science and in methodology, and we will train you in being able to apply those to global health problems. And that there is another question I think is related to that, which from Jordan, who talks about, can you discuss how Imperial defines or differentiates global versus public health, which there are different programs. So this degree that you would be applying for is a Master of Public Health, and public health itself is quite broad. It is based on epidemiology, health systems, statistics, practical applications of those. So there's quite a lot of disciplines. It's basically a multidisciplinary area, and the public health specialist has to integrate evidence and knowledge and practice from many different backgrounds, including biology, social science, etc. However, this is not just a master's in public health, it's a global master, and that is because we are very explicitly trying to address global challenges. So when we look at public health, for example, tobacco issues, we're not just looking at what is the situation in the UK, what's the policies in the UK, how do you do and organise smoking cessation clinics or in the UK, for example. We look at global tobacco control, we look at international evidence, and we look at the approaches and contrast the approaches that are used in different parts of the world. And we think that gives this a particular strength. The teaching staff, the academics, many of us work across many different countries, and indeed quite a lot of us work at global advisory level with WHO, with the International Agency for Research on Cancer, with the Gates Foundation, with CDC, with international agencies, fieldwork all over the world. And therefore it's not just a public health for one area. So I think that's the difference. But I think the key thing to get across is this is about science, about research, and about really teaching you about how to find, appraise, and apply evidence. That's what I think is the strengths of our course. Paul, anything to add to that or other questions?
No, I think that that was a pretty good summary of our approach. I would just add that photograph on the slide was taken pre-pandemic, so it's a relatively old photograph, and the fact they're all huddled up together doesn't reflect our public health views and policy.
As you can see, we're all sitting at home at the moment.
Yes, exactly. And I think to the broader question about, what is public health, what is global health, as both Paul and Helen are saying, there's very many definitions, and I think our course in many of the different specializations that you'll do really goes into detail on this, and you can see the breadth of opinions across Imperial, and I suppose across the public health sphere as well, as to what falls into which category, which is always good fun.
And many of our students take this degree for different reasons. So some will be doing it as a complete departure from their current career in a bid to move down a different route. Some people will be doing it to develop their current career, which may be in public health. Some people will be doing it to supplement their knowledge and skills in the work that they're doing. So it's a very flexible and valuable qualification to have.
Absolutely. Great. Well, I think we've covered quite a number of your questions. I would just say, as we're coming into time, please do go to our website. Please do go to the Coursera website, look through what's on there. There's a lot of really good information. If you do have specific questions, you're more than welcome to send them around. And then we will send out the recording of this as well as an FAQ afterwards to pick up on some of those things that we may not have had time to get to, or some of those really big topics that we know people do ask questions about quite frequently. Great, thank you so much, and we hope that you apply.
We'll be sending you the slides to all of the attendees to this session.
Great, thank you all so much, and have a wonderful rest of your day.